I'm Tina Massengill, Regional Preparedness Coordinator for the Kentucky Department for Public Health.
And I'm Margaret Hibbs, Kentucky Department of Public Health's Regional Preparedness Coordinator.
Well, today we're going to be talking to you about the preparedness branch. And many people in the state of Kentucky don't realize that at the health department there is a preparedness branch, because we are considered first responders, just like the police and the fire in our communities. Now, the reason why we're considered first responders is because we have a role to play in helping making sure our communities are up and running after disasters and during events. So today we're going to be talking about that. What are our roles and responsibilities at the state level? What are those roles and responsibilities at the local level? So basically, we're going to be talking about what are the nuts and bolts of preparedness. Now, to understand that, you're going to have to understand how emergency response works. And honestly, what happens with emergency preparedness or emergency response, as that emergency manager, what he does is he wants to look at the community as a whole. And there's about 15 different components of that community. If all of those components are working properly, then that community is up and running and it's handling whatever's happening to it. So for instance, let's stop and think about that for a minute. If there is a snowstorm, and what are some of the things that you want to know is up and running? That might be, okay, the first thing is transportation. Can I get to where I want to go? All right, what about heat and electric? That's utilities. Can I stay warm? Do I have my electricity? Is the water on? Is it running? The other thing is, can I communicate? Is my telephone working? Are the cell phones working? Can I let someone know where I am? Can I check on other people? Can I use those communications? Okay, well, when we start talking about those 15 different community things that are going on, we call those emergency support functions. And if you'll notice on this chart, the first one is transportation, the second one's communication, the third one's with public works and engineering. So when this emergency manager is thinking about that community and they're thinking about these 15 different components, they're wanting to make sure each of those components is up and running. Now, the component number 8 is called public health and medical services. Now, when we start thinking about that, we're not just talking about, is the health department up and running? Can we open our doors? When we start thinking about our whole community, the public health and medical services, that is the hospital up? Are they staffed? Can they accept patients? Is our mental health facilities up and running? Can EMS move around and get the people that they need to get them to medical attention? So when you think about that kind of realm of community and that kind of emergency management, and you think about public health and medical services, that's called ESF 8. And when at the state level, the Kentucky Department for Public Health is the ESF 8 coordinator for the entire state. And a lot of our local health departments on that local level are also considered the ESF 8 coordinator. And when you think about that and you realize that, it starts to open up a little bit more of the reason why we are first responders is because we can help make sure those systems, that medical system in our community, is up and running in an event or during a disaster. So we're going to talk a little bit more about that.
Now, Tina, how would someone find out if their local health department is their ESF 8 coordinator?
It's a good question. Your planner and your director of local health departments are going to know that, and they're going to have been working with that emergency manager and gotten in there and become a part of that planning group. And each community actually has a EOC, which is Emergency Operations Center, and they have this large book basically, which is all their plans. And in there they actually have what's called the ESF 8 plan, and it lists who is the coordinator there for their community. A lot of times it's going to be a health department. It might be a person from the hospital, it might even be a person from EMS, but someone or maybe multiple partners are going to be sitting at that table helping make sure that that health system is working and running at all times to keep the people safe.
Good job, thank you.
I think another thing we're going to look at that I want to make sure you guys know, because a lot of times all of you are asked to do a lot of trainings for preparedness, and some of those will be ICS or NIMS or HC, and there's all kinds of acronyms, and then there's these big charts that we try to teach you and how things run. I want to assure you of one thing. Today, during Nuts and Bolts, we're not going to talk about those. Today,
Thank heaven.
That's right. We're just going to get down to the nitty gritty and try to help everybody understand what does this really mean and how does public health fit into all of these emergency management and response.
So they can
kind of
sit
thing.
back at their computers and just relax
Yeah,
today.
just relax.
All
We're
right.
not going to make no test today, so that's good, Dr.
All right, no test.
But what we are going to talk about is we're going to look at what are those events to where we were going to have to show up and do something. You know, what about our local health department employees? What do they need to know? What is the health department going to do for them? Also, business continuity. I'm going to talk a little bit about that, and then I'm going to talk about the local health department roles. And I know you've got some things you're going to talk about.
I'm going to pick up what the roles of the state are. What items does the state keep track of when a disaster is occurring? What kind of resources the local health department can request from the state level? Tracking all the costs. There are a lot of expenses when a disaster or response is occurring. Who's going to be keeping track of all those costs? How to get back to normal after a disaster has hit your community? What you should know and who you should know up front to be able to keep your response going across smoothly, and then how do you put all this together and keep this going within your community?
Okay, well, we're going to get started with what's the events. What can come up that we're going to have to be responders to as public health or as that ESF coordinator? So when you think about that, I know the first thing that comes to mind are disasters. And of course, the ice storm. We're a few years away from that, but everybody thinks about the ice storm. Tornadoes. I don't know, there's something about Kentucky that we're having a lot more tornadoes. Flooding, especially in eastern Kentucky, I know they see a lot of that. So we think of those disaster events a lot of times and about how would public health have to respond in those. Well, we also have to think a little bit about those man-made events like an anthrax or a disease, and even planned events are things that we will have a role in, because when we stop and we think about it, ESF 8, that's our medical systems, have to be always up and running, and they can always be affected by any of these things. I know for ice storm, tornadoes, floods, we can easily see how that could happen. If our buildings are messed up, if a hospital is messed up or down or can't be used because of a tornado, we realize, okay, we're going to have to get out there and help them get back up so that people can be taken care of.
Absolutely.
But a lot of times we don't think about a rock slide that cuts off a road. Now, why would ESF 8 be affected? And sometimes it wouldn't be, but I know in one particular event when that happened, what that one road was what connected one side of that county to the other side of the county. So on one side of the county is the hospital, on the other side of the county is EMS. And for EMS to pick up patients and to get them what used to take 15, 20 minutes to the hospital, now it's going to be a detour that's an hour and a half long.
Oh, wow.
So
Yeah.
a rock slide, ESF 8 is going to have a role in that, because they're going to be at the table saying, we can't keep doing this, we have to find another place for these people on the other side of the community to go, because they're not going to last an hour and a half to
Right.
get in an emergency situation.
Absolutely.
So those are things that can affect us as ESF 8 coordinators when we're working with our community, wanting to make sure that everything is running so that everybody's getting the health care that they need, and the healthcare systems are up and going.
Well, how about almost every community has a Christmas parade or some kind of festival. Would ESF 8 have a role in that?
Always, because if you think about it, more people coming in, if it's bringing people in, then you've just increased your chances of a medical surge. So if everybody comes in and then somebody gets hurt or a disease outbreak, then your hospitals could be overran. So you're going to have to be thinking along the lines of that. Also, just what about it being really hot? I mean, what is that blues festival you guys have?
We have what's called the barbecue festival. Yes.
Right.
And lots of people come in for that.
Right, and very hot this year,
Yes,
wasn't it?
it was.
So there's going to be health risk during that time too, and you're going to have to make sure that those people and things are thought about and taken care of ahead of time. And that's part of planning and being a first responder also when it comes to that healthcare system and making sure things are going to run right.
Well, and I can't imagine how many people come in for NASCAR and the World Equestrian Games.
Right.
That could really tax the system if you're not pre-planning and preparing for those
Right.
things.
And I know in those little bitty communities, like my community, we have Tater Day. and it sounds funny up here when I say that. And we also have the banana festival days. So we kind of have some little bitty festivals, but in those little communities, a lot of people come in, and on their healthcare system, if something happens, they're not going to be able to handle that. So we got to plan ahead and think ahead. And so our other hospitals are planning ahead and thinking, okay, yeah, we can get them over here to us to help if something were to happen. So yeah, there's a lot to be thinking about. Okay, so those are the events that could happen that we would need to respond to as ESFA partners. And then I think the other thing we need to be thinking about is, when you talk about the nuts and bolts of preparedness, is what about the employees? We need to be thinking ahead when it comes to our employees as local public health, as an employee. Now, first off, if you're responding, your safety and health, as a responder, as an employee of that health department or the state health department, your safety is our first concern. So a lot of times you're being asked to do safety trainings, or going ahead and making sure that you have equipment that's up and ready to go that you could be called out for. Also, when it comes to your families, we're going to need you in an event. I think that's the big thing. We need you, but we're not going to be able to use you if you're not going to be able to come in and help if you're not ready, if your family's not ready. So we want to encourage everyone also during this time to start thinking about that. If an event happened and we need you to come into work, do you have a family plan? And if you don't, we want to encourage you to go to ready.gov. I think that's it.
Yes.
They have a great place on there where you can go through, and it shows you how to do a family plan. It'll help you be prepared at home also for taking care of these events that might happen. Another thing that we're looking at is accountability. We need to know where you are to make sure, one, we want to know that you're okay, and also we might need to be able to call on you. So that's accountability there. As far as public health goes, when you come to us, like during the ice storm, I know that we had people coming in to work. Well, at lunchtime they couldn't run down to McDonald's because McDonald's was closed. So we were making sure that we also had food for them, and we were taking care of those kind of needs too. There's going to be a lot of stress during a response, and so a lot of the times when we're talking about preparedness, we're also talking about thinking ahead and knowing how to handle that kind of stress, knowing how to look out for one another, and a lot of times our trainings are going to be about that too. So
now, I know, like, you and I are preparedness staff individuals, so we understand the importance and the reason why we sit through a lot of these trainings, but there are individuals within the health department that might be watching this training today saying, I'm not a preparedness staff member, why would I need to know any of this information?
You know, that's absolutely right. A lot of times they're thinking, the director and the planner is going to take care of that. Yeah, I'll never be called out. But that's just not true anymore. I think most health departments, as part of their getting ready to be a responder, they have taken every employee and they've put them on what's called a tier. And that means they've sat and they thought about, in an event that something happens and we as a health department need to respond, where would this person be? Would they be a lead role? Would they be just coming in and doing something they're being told to do? Every one of them is being put into a tier. And according to that tier that they're put into, they've been asked to do training. And the reason for that is there's a very good chance that they're going to be called up and asked to do something. Because let's just take that anthrax we were talking about a while ago. We realize in an anthrax event, they say in 48 hours, we have to be able to medicate all of the people that were possibly exposed. It could be an entire community within 48 hours. Well, local health department has to, if they're asked to do that, it's going to take every employee they got and a whole lot of volunteers to go get around and to make that thing happen. So even though a person's not a first, the planner or the director, that doesn't mean they won't be called out. Doesn't mean they won't be asked to help, because in an event, it's all hands on deck with most places, I think.
So that goes back there again to just the importance of every individual within the health department having that family plan.
Yes.
Communicating with your family and letting them know up front, in the event that we have something going on at the health department, I may be called in, and our family knows what to do.
Right.
So that ready.gov is extremely important.
Yes, very important. Okay, business continuity. We also want to talk a little bit about the business continuity of that. And in preparedness, what that means is we have worked with health departments and asked them to come up with what is called a continuity of operations plans. We call it the COOP plan. And basically when we talk about COOP plans, what we're saying is stop and think for a minute. If something happens to your building or to your staff that would affect your ability to do a service, how are you going to provide that service anyway? Because there are certain services in public health that we consider essential functions or essential services, and that means even if the building burns down today, tomorrow we still need to be able to get out there and do X, Y, and Z.
Because public health has got to be there.
That's right, public health.
Right.
We don't just go home and stay home. We get out there and we're there and we're part of the community, and we have to be there to help assure their safety. So that's what this plan is about. It's about making sure that we know that we can get up and start running again within 24 hours, within the next day. And also part of this plan is figuring out what is the essential functions. Do we have to do Pap smears tomorrow, or can those be put off a couple of weeks? Do we have to do food inspections if the electricity's been off, or can that be put off a couple of weeks? So that's when we start looking at essential functions. It's mainly talking about let's list our functions that we do, the services we provide, and let's put a timeline on them. How long could we go without doing this? Some things have to be done immediately, and some things can wait a little bit. And this plan is just there ahead of time to help in an emergency situation. And we've had health departments that have actually had to coop. Their building flooded or was burned down or something like that. And because they already had the plan in place, they knew what they wanted to do. They knew who they wanted to call into work. They knew where they wanted them to go. And that's the other part of cooping, is figuring out where would we go set up until we could get our building back together and could use it again. And that's what they've done. And it's allowed them to think about it ahead of time and to be prepared for what they're going to do in an event like this. And I think that's the big thing with COOP, or with preparedness. I mean, that's the name of the game, is we're thinking ahead, what could happen, how can we handle what could happen. It's about making plans.
Now, can I, as a local health department employee, since all these plans have been put into place, and if my building is destroyed, can I pre-read these plans so where I would know where I need to go?
Right, exactly, yes. You need to talk to your local planners and find out where those plans are so that you can look over them and have a better idea of what you're supposed to be doing. So that's the key. Good. Local health department roles. We're going to talk about that for a minute. When an event happens or a disaster happens, one of the things we want to make sure about is that local health departments know how to communicate. They need to be able to communicate with their staff, and I think we've talked a little bit about that. Might be through a phone tree, part of making sure all of your information, they have all your information. They need to know how to communicate locally to their partners, and then they also need to know how to communicate to the staff. I know that you're to the state. I know that you're going to be talking about the shock in a few minutes and more about the state stuff. So we'll kind of let you touch on that more.
Okay.
But that's there, and those are some of the things that local health departments need to know how to do. They're going to also need to be maintaining their essential services and their surveillance. Surveillance has always been the big thing of public health, and a lot of people just didn't realize that that's really considered a first responder kind of duty, and that we're watching the community's health, seeing if something's going on, if there's anything out there that we need to be tracking, and then being able to request help. It's important that local health departments know their partners, know how to ask if they need something, to try to get that locally, and if they can't get it locally, to know how to ask the state level. And again, you'll talk more about that. And filling in the gaps as part of planning and looking around and seeing, okay, what do we have in place? If this event happened, what do we not have that we need, and how can we get that? That's filling in the gaps. And all of that, again, that goes back to we're planning ahead of time and trying to be prepared for whatever might come.
All right, like Tina said, I'm going to hop in here and I'm going to talk about kind of what the state roles, what does the state do when a disaster is happening at the local level? We do have a place. Tina promised not to sneak any acronyms in, but she snuck in one. It's called the SHOC, the State Health Operations Center. Is a location at the Kentucky Department of Public Health where lots of partners come in and work on a response, doing a lot of activities behind the scenes, helping local health departments handle the disaster or the response that's happening there there in their local community. Communication is extremely important to provide communications to the state about what's going on in your local community. We have a lot of technical equipment that can be used to do that. We also have people in place to help provide that information and get those lines of communication open between the local health department and the state health department. Also, situational awareness. The state has actually created jobs. They're called the Regional Preparedness Coordinator. Like Tina and myself, there are 15 of us all together that are boots on the ground to help provide situational awareness immediately when a disaster happens in one of our communities within our regions. Also, coordinating the response. That's another reason that the Regional Preparedness Coordinators were put at the local level, so that we could help local health departments coordinate the response if we were requested to do so. Also, provide manpower. Disasters and responses can take long periods of time. It may be something short that a local health department can handle, such maybe as a flooding of their building, but it may be something like Tina talked about, like the tornadoes in West Liberty. That was something that went on for a long period of time, and manpower became in short. So we were able to send individuals in to assist that community. And then also resources. There are many, many things a local health department may need, but it's not something that's feasible for them to house 24/7 like mass casualty trailers. So the state has those types of trailers and resources that can be requested when a community is to need those. And then also press releases and guidance. The state health department can set up ITV, interactive television. They can also provide conference calls to give the most updated guidance in time of disaster or a response. Then also tracking. The state tracks a lot of different things. The state tracks their illnesses using the regional epidemiologist. They track the shelter and the surveillance that goes on in the shelters using their environmentalist. They use the hospital preparedness coordinators to look at their health care facility damagement. They also track staffing and if local health departments need additional manpower brought in. They also track resources if there is a request for any type of unmet need or material or equipment that local health departments would need in a disaster. And any kind of incident specific items such as vaccines or the strategic national stockpile, the state can track those resources also. And then any unmet need that a community would have, those resources could try to be gathered locally, and if they can't be found locally, then they can be asked for the state to bring those resources in. If the state doesn't have them, then we can ask the federal government to possibly give us those resources. All right, it is very important that all local health department staff know how to get resources and what resources they have in their communities. It's important to know that you need to start with your local emergency management first to see what resources you have in your community. If your community then is without the resource, then you can begin asking the state for the resources to be brought into your community. It's important when you're asking for resources to be extremely specific in what you're needing. How long are you going to need it? What size is it? What are you trying to do with it? Any kind of details. We've been asked for a tank before. Why Tina would just be asking for a tank cause a problem or pose a difficulty for the state to be able to handle that?
Well, when you're on this end and you're receiving that call and they're saying, give me a tank, you know, a lot of things are popping into your head, and a part of that is who's receiving the phone call. If I'm a firefighter sitting here helping receive phone calls, when you say a tank, I'm thinking a water tank that I can bring in. I could be an oil tanker. If it's my kid sitting here getting your phone call, which we'll hope that doesn't happen, they might be thinking the fish tank. You know, you need a fish tank for something? And also medically, I'm going to be thinking oxygen tank, you know. So there's a lot of different things that could mean when you say tank.
Right, if you've got a nurse on one side of the phone and they're talking to someone up at the state and they're thinking tank, they may actually be thinking that oxygen tank.
Right.
If you've got an environmentalist on there, he might be thinking potable water tank. So there are a lot of different ways, and so you want to be very specific. Also, some of this equipment has to be borrowed from partners, so it's important to know how long you're going to need the equipment and exactly what type of equipment that you need. So be very specific when you're asking. Now, the state does have a lot of resources. They have a lot of what's called PPE, personal protective equipment. They have a lot of equipment and resources that can be used for medical surge, and then they have a lot of communication equipment, talk machines, satellite phones, a lot of things that can be brought in that here again is not feasible for a local health department to house all the time. It's not cost effective to do so. So those items can be borrowed and brought in from the state. Tracking cost. This is one of the most overlooked parts of disaster, and if it's not tended to, can be a disaster in its
Right.
own. It's important to have someone start very, very early, tracking any time, equipment, any contracts, MOUs, or agreements that have been utilized by partners. Someone needs to be assigned to this specific task, and it's really good if that person's been able to attend like the FEMA training on how to fill out those FEMA forms, because that can be a difficult task to do. So there again, that's another part of pre-planning and preparing for disasters within your local health departments. Every expense needs to be tracked. There may be a cost center that's different that you'll want to code to. There might be some kind of equipment that's new to you, so you'll want to make sure that all of that information is written down and where that equipment has been used and how long. And also, if you've used volunteers, tracking their hours and their times, individuals within your community that have come in to help you.
You said something about cost centers. Now, if their cost center is supposed to be something different they're coding to, how do they know? How do they know what the cost center is?
Well, oftentimes, just like the training here today, your supervisor may have told you before you take the training today that you'll want to code your time to this particular cost center. In times of disaster, oftentimes, so they can track what staff are spending their time on, they'll assign a cost center to a disaster or response. So your supervisor may be given that by their supervisor and trickle down that information, and you'll want to make sure that you're tracking that on your timesheets. So check with your local supervisor, your local health department about that. Getting back to normal, this is a no rest for the weary. There's a lot of work to be done when shelters have to be closed and equipment has to be returned. All the individuals that may have been displaced in a community have to be returned to their homes, or new homes have to be built. The health department, if it has to be rebuilt or put back together, a new structure may have to form. You may have to work out of a different location. Your job may not be what you had your normal job as before. It may be a new job. Lots of paperwork goes on for a long time. Those individuals that were tracking all those receipts and all those costs have to roll all that up. Reports have to be turned in. After action reports have to be done about the event. And then all of the people that were borrowed, the manpower, the stuff, the equipment, all of that has to be returned. And that all takes some time, and a lot of patience is needed by staff. And just listening and following your supervisor's instructions is extremely important.
I see on there you've got shelters being closed. So what are the local health department's roles in sheltering?
Well, different local health departments have different plans. So here again, just like Tina said with the continuity of operations plan, you'll want to check with your local health department planner. Many of the local health departments provide epidemiologists for disease surveillance within the shelters when they're open. Also, the environmentalists come in and do surveillance of food and food safety and sanitation. And then some of the health departments have nurses that do phone consultations, and some of them partner with local American Red Crosses to set up medical needs shelters. So here again, you would want to pull your local health department's policies and procedures and see how involved they are in your community sheltering plans.
Okay, good.
It's important also to know up front who you know in your community up front is very important. It's important to build those community partnerships and those roles before disaster in calm times like we are now. It's important for us to know who in our community we can call on for different types of resources. So it's good to constantly be working with those partners. And all of us in all of our job duties attend a lot of different meetings and get to know people. So those meetings are extremely important. Also, it's important to remember how to contact that SHOC, that acronym that Tina stuck in there, that State Health Operational Center. And then also people like Tina and I, your local RPCs, can provide a lot of information of what the state can help you, what resources we can help you get in times of disaster response. Also knowing your local health department's plan B. What does your local health department do during a power outage? What does your local health department do when the phones go out? What do they do during a tornado? Where is your safe room in your local health department? As an employee, it's very important for you to be proactive, to know the plans for your local health department has for you in times of disaster or response. Also, that tracking cost. Anytime you're asked to code to a particular cost center in times of disaster, please do so. So that is so very important for your local health department to get reimbursed after the disaster or response occurs. Also, knowing where you fit in your local health department's organizational chart. Like we said earlier, you may not be on a day-to-day basis a preparedness staff member, but you will be utilized. Your skills skills that you use on a day-to-day basis are very important and will be utilized in times of disaster to help your community respond. Also, what kind of resources, where are they? If you've been asked to perform a certain duty on a particular type of equipment, make sure you've been trained on how to do that type of equipment. And it's important for you to work with your preparedness staff. If you're ever unsure of how to use an equipment like a satellite radio that you've been asked to use, have that preparedness staff go back over that with you. They'll be more than happy to do that. Also, what resources do you have locally? What resources can you get regionally, and then what kind of resources can you get from the state? And there again, you can work with your local RPC on that, Regional Preparedness Coordinator, and then also your local preparedness planner too.
Right, and just maybe knowing where the stuff is going to be your first step. I think you mentioned earlier, if you've seen a trailer out in your parking lot that has something about planning on it or preparedness, maybe find out what's in that trailer. It might be a big help in an event.
Yeah, because sometimes people are like, I think I know what's in there, and then you open it up and they say, that's not what I thought was in there. So it's important to know. Here again, that proactive, the preparedness department wants to help you know what type of resources that you have available, and we want to work with you to make you feel safer in your local health department and in your community, and how you can help in times of response or disaster. We're not hiding anything. All right, putting it all together, this slide really is a great slide about what your preparedness team at your local health department is doing for you on a day-to-day basis. They're looking at plans for your community, plans for your local health department, scenarios, things that could happen to you. They're sitting writing plans on those man-made disasters, those natural disasters, those community activities that's specific, like Tater Day for Tina, it's specific to her local health department. Then they're creating trainings for the local staff to go through so that they know what they're expected to do. And if there is any type of equipment, providing training on that equipment so you feel comfortable using that equipment. And then they'll put an exercise together where they bring all of the staff together and all of the community partners to practice and to play together and get to know each other in a very calm situation, and to test those policies and procedures that have been put into place to see if they actually work. And then after it's all over, they'll do an evaluation and see how you felt about it. See if there's changes, maybe something that they didn't think about, that you, because of your day-to-day job or the skill set that you have, notice that maybe we could do this in a different way, a better way, or a safer way. And then also they work within the community on networking with community partners, people that can bring supplies, resources, and equipments in times of response or disaster, and pre-identifying those individuals. They also work on gathering grants. And then during Disaster September Preparedness Month, they work on employee morale, providing lots of information like information off the ready.gov and how you can write a family disaster preparedness plan.
In conclusion, the nuts and bolts of preparedness is about how public health helps in the community in times of response. And I want to thank you for the time you spent with us today, and I want to encourage everyone that if you have any more questions about your preparedness department or the plans that your local health department's involved in, please talk to your preparedness planners at your local health department. And you can always talk to the regional preparedness coordinators if you're interested in what the state has to offer and the things that we can do for you from the state level.
Tina and I want you to know that it doesn't matter if you're the janitorial staff, clerical staff, a nurse, a preparedness staff member, or a director of a local health department. It's extremely important for you to be proactive in disaster planning with you and your family. We want you to visit ready.gov and get all of the information to make a plan for you and your family so that you can respond for your community in a time of disaster.
Thank you for your time and have a great day.